Legalizing euthanasia for terminally ill patients. What if your final wish was to end your suffering? Would you be allowed? Hello everyone. My name is Mohamed Ensar, and today I will be discussing one of the most debated and emotionally charged topics in modern medicine, euthanasia. Specifically, I will argue why it should be legalized for terminally ill patients. When someone is facing a terminal illness, knowing that no treatment will save them, the meaning of life shifts dramatically. Uh, Pain, loss of dignity, and total dependence often define their final days. Despite medical progress, not all suffering can be eliminated, and that's why the right to choose how one's life ends uh, is such an important question. And in this presentation, I'll explore how euthanasia, when properly regulated, can honor patient rights and relieve suffering. I believe euthanasia should be legalized for terminally ill patients for two main reasons. First, it upholds patients' autonomy, their right to make decisions about their own body. And second, it prevents prolonged and it's it's yeah, it prevents prolonged and unbearable suffering when no other options remain. Respect for autonomy. In medicine, autonomy is a core principle. Patients can refuse surgeries, stop treatments, and even write advance directives. So why can't they choose the timing of their death when the outcome is inevitable? According to a study by Emmanuel in 2016, many patients facing terminal illness place autonomy above everything else. They want control, they want dignity, and legalizing euthanasia would make that possible. Relief from suffering. There are conditions where pain is constant, uh, where patients cannot speak, move, or even breathe without machines, and ALS is one of them. Advanced ALS patients, according to Lancet Neurology in 2023, reported that patients with ALS increasingly request euthanasia not because they want to die, but because they want the suffering to end. And when even the best uh, palliative care fails, shouldn't we have a humane legal option for those who ask for it, not for everyone? There's a counterpoint. Critics often say that legal euthanasia devalues human life and could lead to a slippery slope where people might feel pressured to end their lives. For example, John Keown in 2002 argues that it could erode society's respect for life and damage the trust in doctors. But we have clear counter evidence. Countries that allow euthanasia, like Netherlands or Canada, have strict safeguards, psychiatric evaluations, multiple physician approvals, and consent at multiple stages, not even one. So the result is that abuse is extremely rare. Regulations work, and euthanasia doesn't devalue life. It respects the patient's voice. In conclusion, euthanasia is not about choosing death. It's about choosing how to face it. For terminal patients, it offers control, dignity, and relief. When all other options are exhausted, forcing someone to endure endless pain is not compassion, it's cruelty. Legalizing euthanasia is a moral responsibility and one that puts patient care first. These are the references I've used in my research, and thank you for listening.